My name is Jean Marie Thompson, and I live in Florida. I'm 62 now. I was diagnosed with Wilson disease around the age of 16, and I was started on cupramine. That was the only drug available back then, and my neurological symptoms got much worse when I started that. I was unable to attend school because I couldn't speak and I couldn't write. My mom took me out of school and I was out for about 2 years total. When zinc came out, I switched from cupramine to Galzin, which I was on for many years. But Galzin became very expensive, so I switched to over-the-counter Gluzin that I get from Amazon. And that seems to control my symptoms pretty well. I'm filling my medication box for 2 weeks, and for my Wilson disease, I take 1 tablet 3 times a day on an empty stomach. Now, it may make you a little nauseous, it does me, so I take a bite of something to eat. It's supposed to be on an empty stomach. I do the best I can do. Some of my symptoms from Wilson disease include dysarthria, which is speech difficulties. That's probably my biggest challenge. If I think about what I'm going to say before I say it, it comes out perfectly clear. During this interview, I'm thinking, oh my gosh, am I sounding okay? Is my speech clear enough for people to understand? People have assumed I was drunk or impaired, including someone that called my boss once, and a pharmacist who thought I was intoxicated. It was very embarrassing. I get fatigued easily from Wilson disease, and I have dry mouth a lot, which isn't fun. And I still have problems with my fine motor skills. My handwriting is pretty much illegible unless I write really slowly. Joint pain is also a long-term side effect from what I think from the cupramine all these years, or might just be from the Wilson disease. I've had a shoulder replacement and a neck fusion because of early onset of osteoarthritis. Again, depression is another symptom. I have no reason to feel that way. My life is good. But the depression seems to be neurologically connected to the Wilson disease. My brother also had depression and Wilson disease. He died from being non-compliant with his medication and treatment. The medication does help me function. I was able to become a nurse and get my business degree, which doctors told me I might never be able to do when I was first diagnosed. But the daily management is exhausting. When I'm working on the floor as a nurse, I'm crazy busy. Yes, I have an alarm set on my phone to remind me to take my medication. But sometimes I just miss doses. The biggest downside of my treatment are nausea. All the medication I've ever taken for Wilson disease makes me nauseated. And the complex dosing schedule is really challenging. Taking medication 3 times a day on an empty stomach is incredibly difficult for compliance. So speaking of compliance, I'm an RN, a nurse, and if I was educating a patient on the disease that I have, the Wilson disease, I would tell them it's very, very important that you don't miss doses of medication. If you continue to do so, you will die. And still, I miss doses. Shame on me, but I do. I'm going to be honest. Short of a complete cure, my ideal treatment would be an IV infusion once a month or every 2 weeks, I would absolutely love that. My second choice would be a one-time a day dosing. I could comply with that, no problem. What I really want is something that gives me quality of life. I'm about quality of life, not longevity without quality. And that means being able to participate in normal activities like sharing meals with friends without having to worry about medication timing every single time. Thank you for listening to my story.